Hi, I'm Danielle. I'll be doing Chapter 5, Question 2. The Bureau of Primary Healthcare is the home of many federal efforts to address healthcare disparities for lower SES individuals and other vulnerable populations. Describe two initiatives of the Bureau of Primary Healthcare, discuss their purpose and scope, and identify what level of overlap there is between these programs in terms of their design and purpose. Does either program address multiple risk factors? Okay, so the first one is the Robert Wood Johnson Foundation, and this is to align forces for quality to improve the care of the care that Americans receive. They do this by raising the quality of care, raising the standard, raising the standard for the quality of care that vulnerable or targeted American populations receive. And this has two phases, and the phase one includes grants and assistance to community leaders, and this is to assist them with physicians and raise the quality of care and measure the publicly report quality data. Phase number two is to include hospital care and specific focus on reducing gaps in quality for racial and ethnic minorities. So the first part basically is to just report how people rate the quality of data, and the second phase is what is going to help the people, to reduce disparities. Okay, the second one I have is Puget Sound Health Alliance in Seattle. And this alliance, I really like it. It sounds really good to me. Is to improve the health literacy for the people, for the vulnerable population. So, like for someone who doesn't speak English well, they won't understand what they're being told. But this alliance will help them make sure that they understand what they're being told, and make sure that they're being told it in they're being told good quality information. And this also releases the public communication checkups and is updated annually. The third one I have is the Kellogg Task Force on Disparities, and I think that this is good that Kellogg's is doing that. I heard of Kellogg's ever since, from growing up, but this is a great thing that Kellogg's is doing, but it wants to expand the training of health professionals to get involved in disparities research and policy making and interventions. Their mission is to engage accredited schools and programs of public health in partnership with community leaders in teaching, research, and intervention and things. I think that this is a good idea, especially to get the schools involved, because the students can be, their targeted population, just to see how things are working. But their goal is just to eliminate health disparities. So the overlap would be all of these programs are focusing on eliminating health disparities in one way or another, and they all have the reported data, reported quality data, and they're updating it annually. They all do.